Good morning. Over the last several weeks, the boards of the Jewish Hospital and St. Mary's Healthcare, St. Joseph Health System, and the University of Louisville Hospital and James Graham Brown Cancer Center have met to go over the details of a formal agreement to create one entirely new organization. Today, I'm pleased to announce, with intent to meet the needs of the people of Kentucky and beyond, every board has unanimously approved this partnership, and we are moving forward. I am Bob Hewitt, as you already know, and I am honored to be the board chair of this new partnership. We started this journey together more than 2 years ago. The process has involved thousands of hours of meetings and collaboration, and our purpose when we began was the same as it is today: to transform healthcare in Kentucky. This partnership will answer the demands of the proposed healthcare legislation and will reshape the healthcare landscape in Kentucky and the region. By coming together, we will bring our collective expertise and quality to patients and their families, even in the most rural areas. Already serving more than 500,000 of the state's citizens, our map illustrates our current reach. We plan to expand access even further through embracing the latest technology, establishing new partnerships, and enhancing existing services. Individually, each organization already provides extraordinary patient care, but together we will provide an unmatched geographic reach from Louisville to Paducah to Lexington and to Martin. You will hear from several leaders today, both from the partner organizations and our sponsor organizations, and they will continue to illustrate the rich history that will make up the fabric of this new organization. As a current member of St. Joseph Health System Board, it is my pleasure to introduce Dr. Dan Varga, Chief Medical Officer of St. Joseph Health System.
Thanks, Bob, and welcome to everyone. St. Joseph Health System has a tremendous reputation and history in this state. 3 years ago, multiple hospitals came together to create what is now St. Joseph Health System, and they made the commitment to honor the collective heritages of each organization and allow that blended culture to respect our past and prepare for the exciting future we held together. Today we celebrate the same opportunity to honor our respective heritages with the announcement of this new statewide organization. Of St. Joseph Health System's 9 facilities, St. Joseph Hospital in Lexington is the largest and also the oldest, with its roots dating back to 1877, when the Sisters of Charity of Nazareth established the city's first hospital. And from that humble beginning of a small house to a major tertiary referral center, it's the beginning of what we have celebrated for many, many years. The first heart cath in the state of Kentucky and the first open heart surgery in Lexington. That pioneering spirit is the reason behind the success of St. Joseph Health System, because we share the best practices and learn from each other for the greater good of the organization, and we look forward to doing the same as we move forward with our new partners. As a physician, I have a keen understanding of the state's health status and our need for more doctors. At St. Joseph Health System, where we have hospitals in several smaller communities, we also have firsthand knowledge of our need for physicians in rural parts of the state. And with our increased presence in smaller towns, we plan to change that for the better. We will, with our new partners, focus on retention and recruitment in areas of need, especially in primary care and targeted subspecialties in rural areas. And we will expand and coordinate continuing medical education across the state. The new organization will pride itself on unparalleled transparency and accountability. I'm proud to be here today with my friends and colleagues from Louisville, Lexington, and across the state. And we are hopeful that together we can improve Kentucky's national ranking of health status, thereby improving the quality of life and happiness of our citizens across the Commonwealth. It is now my pleasure to introduce Mr. Michael Rowan, Executive Vice President and Chief Operating Officer of Catholic Health Initiatives. Michael.
Thank you, Dan. In Catholic healthcare, mission is the constant, reflecting our past and guiding our future. Here in Kentucky, CHI's history is built on the legacy of the Sisters of Charity of Nazareth, who we recognize proudly as the foundresses of many of the hospitals that are part of the St. Joseph Health System today. Next year, the Sisters will celebrate the bicentennial of their congregation, 200 years of service and ministries that began on the Kentucky frontier and now span the globe. If there's one thing we've learned from the Sisters' example, it's the need to forge ahead, take risks, and change with the times. And that's why we're here today. With our partners, we will work to transform and improve how healthcare is delivered in the Commonwealth. Now, what does that mean for patient care? Specifically, it'll be about greater access to care, especially in medically underserved areas, new models of care and treatment modalities built on evidence-based practices, superior quality that is a standard across the system, education and research that adds value to patient outcomes, and ultimately, healthier people and communities in Kentucky and beyond. At CHI, we've been asked why we're taking this course in Kentucky. We consider this partnership a mission imperative. Only by partnering with other leading providers, having a clear and compelling vision for the future of healthcare, and charting a new course can we ever hope to make the kind of difference that Kentucky so desperately needs. We are proud of what we will contribute to this initiative through St. Joseph Health System and the other CHI sites of care and resources around the country. We look forward to building on our successful partnership with Jewish Hospital Healthcare Services, and we are excited about partnering with the University Medical Center, which will mark the first such relationship between CHI and a premier academic medical center. Together, we will reshape the landscape here in Kentucky. And now I'd like to introduce Dr. Jerry Timmes, Chair of the Jewish Hospital Healthcare Services Board. Jerry.
Thank you very much, Michael. I'm extremely happy and proud to be here today on this occasion where we are going to create an organization that will be an honor for all of us to be involved with and be a real benefit to the state of Kentucky. This is a day to celebrate our histories as we look forward to our future. We will be one organization. We want to take a few minutes to just tell you a little bit about the important relationships that we have had over the past 5 decades. When Jewish Hospital was originally envisioned in 1903, our fathers looked to the future to create a hospital where all physicians could practice and all patients could be treated, regardless of race, creed, or religion. The desire to treat all patients, regardless of their ability to pay, was central to that vision. Over the decades, as Jewish Hospital grew, we evolved into an organization that recognized and honored the value of medical research and education. Our forefathers made a commitment to partner with the University of Louisville, with the School of Medicine, to invest jointly in future physicians, nurses, and researchers. One of the primary reasons that the Jewish Hospital was built at its current site in Louisville in the 1950s was to be close to the university. This vision has driven our organization for decades. Because of the investment, medical training and research have benefited. Today, we are at a new beginning. The Jewish Hospital Healthcare Services Organization is incredibly excited about the future of our organization as part of a statewide network that you've already heard about. We are committed to being an active, engaged partner in shaping the future of this great state. As a retired thoracic surgeon, I'm proud to tell you that Jewish Hospital Healthcare Services also understands our unique ability as an organization to continue our decades-long support of the Academic Medical Center. For this new organization to be successful, access to ongoing funding for research and programmatic development will be critical. Going forward, the JHHS board will set aside significant resources, primarily for the continued investment in medical research, education, and training, and programmatic development within the Academic Medical Center. This continuing commitment will ensure that JHHS continues to honor the legacy of those who preceded us and lays the groundwork for those who will come after us. With recognition of the past, we move into the future with a shared vision of creating a world-class academic medical center and a leading statewide healthcare network for all the citizens of the state. Thank you very much for being here, and I would like to now introduce Lou Ann Atlas, who is the chairman of the Jewish Hospital Healthcare Services Board.
Thanks, Jerry. And it is my pleasure to be here with you this morning. It is a great day for the citizens of our Commonwealth. The word partnership is one that cannot be underestimated. The organization that I govern, Jewish Hospital and St. Mary's Healthcare, is a partnership between Jewish Hospital Healthcare Services and Catholic Health Initiatives. And as Jerry mentioned, we're also partners with the University of Louisville. In 2005, when Caritas Health Services and Jewish Hospital Healthcare Services merged to form Jewish Hospital and St. Mary's Healthcare, we had a shared vision for improving healthcare delivery in our community. Both organizations had unique strengths. Caritas had one of the country's largest psychiatric facilities in the country, along with a thriving physician network as part of their health system. The Jewish Hospital Organization had a new model of care that focused on extending ambulatory care services to the communities where our patients lived. Together, we have built upon both of those strengths. Since our merger, we've opened a number of new ambulatory facilities. We've added additional facilities for those needing psychiatric services. And we've partnered with dozens of physicians to develop an impressive physician healthcare organization. Our other critical partnership is with the University of Louisville. For decades, we have worked to improve the quality of life for all of our communities and to develop new medical procedures that have changed countless lives. Together, we have performed medical research such as the world's first successful hand transplant in conjunction with Kleinert Coutts and Associates. University physicians, led by Dr. Layman Gray, implanted the world's first totally implantable replacement heart at Jewish Hospital. And most recently, Dr. Susie Harkema, a university researcher, gained worldwide attention with her groundbreaking work she is doing at Fraser Rehab Institute. The partnership has changed lives forever. So as I reflect on the word partnership, I think of the shared commitment and passion that our respective health members and physicians bring to our individual organizations, and how together I'm confident that we're going to build a world-class organization that not only changes lives for the people in the Commonwealth, but around our country. And now I welcome a valued partner, Dr. Jim Taylor with the University of Louisville.
Good morning. It's been my privilege to have served the past 15 years as the CEO of University Medical Center, whom the community knows as University Hospital and the James Graham Brown Cancer Center. The partnership that we're talking about this morning will effectively double the size of Louisville's Academic Medical Center as we bring together Jewish Hospital, Fraser Rehab Institute, University Hospital, and the Brown Cancer Center. It also formalizes a long history of collaboration between our organizations. In addition to the long-standing partnership with Jewish Hospital that resulted most recently in the neurosurgical breakthrough that Luann just spoke about, University Hospital neurologists have been seeing patients at St. Joseph through telemedicine robotic technology for several years. But this partnership that we're talking about today, in spite of the rich history that we all bring to it, is really about the future. For patients and families in Kentucky and beyond, the new academic medical center will mean increased access to the latest developments in diagnostic, therapeutic, and preventive healthcare developed by some of the nation's leading physician scientists at the University of Louisville. In particular, more Kentuckians will be able to reap the benefits of Kentucky's first nationally accredited breast care center at the James Graham Brown Cancer Center and Kentucky's first certified primary stroke center at University Hospital. For future physicians, nurses, and other allied health professionals, this partnership means enhanced and extended learning opportunities, both in Louisville and in partner hospitals across the state. By extending learning opportunities, we hope to effectively address the physician manpower shortage that's being experienced in so many communities in the Commonwealth. Bottom line, this partnership is about improving the overall health of the communities that we serve, all of those communities. Unfortunately, Kentucky consistently leads the nation in incidence and risk factors for cancer, obesity, and death due to heart disease and stroke. By training more physicians, sharing our academic expertise, and collaborating on best practices, this partnership is poised to make a difference in many lives. My thanks to all of those who have worked so hard and so long to bring this vision to life. And now it's my pleasure to introduce Dr. James Ramsey, the president of the University of Louisville and the chairman of the UMC board.
Good morning. Michael talked about Catholic Health Initiative, CHI, and he said mission is the constant, and so it is with the University of Louisville. In 1997, the Kentucky General Assembly adopted the Post-Secondary Education Improvement Act of 1997. And while it was a massive piece of legislation, over 200 pages, it was a very simple bill in its intent. For the Post-Secondary Education Improvement Act was about a better Kentucky and was about higher education doing all that it could do to improve the quality of life and economic opportunity for the people of our community and state. And so our announcement today is a reaffirmation of our commitment at the University of Louisville to the goals and the mandate of the Post-Secondary Education Improvement Act of 1997. This merger will be an embodiment of that legislation. Luann and Jerry mentioned the long-standing partnership that we've had with Jewish, and it's been a great partnership and a valued partnership, and we look forward to taking it to the next level. We're excited to partner with St. Joseph and Catholic Health Initiatives. This is an organization that is committed to quality health care for the people of our state. This is an organization that is committed to quality health care for all people of our state and to providing access to quality health care for all people within our state. This is an organization that is committed to Kentucky, has been in Kentucky, and has, as you can see from the map, facilities throughout our state. And this is an organization that has values that we at the University of Louisville value. So today is about what every one of our previous speakers mentioned, and that is a better Kentucky, better health care for all the people of Kentucky. But for us at the University of Louisville, it is all of those things from a clinical perspective, but also This partnership between our organizations will allow us at the University of Louisville to continue to build on the great teaching programs and education programs on our health science campus. What we're talking about today in terms of this merger will allow us to continue to build our world-class research programs with a focus on translational research, research that truly makes a difference in the lives of people. So today is about us at the University of Louisville continuing to move forward to meet our statutory mandate given to us by the people of Kentucky, and that is to be a premier nationally recognized metropolitan research university. So we're very excited. This is a great day, not only for the University of Louisville and our community, but for the entire state. So I'm now looking at Mark, and thumbs are up, so we're going to introduce you to one of our truly outstanding faculty members, a faculty physician researcher who is responsible for putting in place our stroke program at the University of Louisville. Both St. Joseph and the University of Louisville over the last number of years have used the highest form of telemedicine, and it's this robotic application of medicine. So Mark, what do I do now? Just get out of the way? Okay. You're going to meet Dr. Carrie Rimmel.
Morning. Morning. How is everyone? Doing well. I think so. I'm so happy to be here. Thank you, President Ramsey, distinguished guests. What I'd like to say is that I am beaming in. I'm Carrie Rimmel. I'm a stroke neurologist, University of Louisville, and I'm beaming in from the 9th floor of University of Louisville Hospital, where one of my control stations is. I have control stations at Jewish Hospital. We have them at my home. We have them at the clinic facilities, and we have 450 doctors at the university who really could be capable of using technology like this. It's not new to me, and it's not new to the United States. But what's exciting is that we are going to expand from now 11 robots in hospitals around the state of Kentucky, central and western Kentucky, to a greater number, because St. Joe's healthcare system has robots as well. And we are not just expanding in technology. Of course, you see this technology is pretty high end, but we are not just expanding in this technology, but also in other technology and in the numbers of doctors available. So now, with our expanded network, we'll have 3,000 physicians who can continue evidence-based care, research, and education for the state of Kentucky. What we want to do is to have a healthier Kentucky and a healthier region. And so our goal as physicians is to partner with each other, use the technology that we have to reach all parts of Kentucky and the region, and to give the evidence-based care to all patients, no matter where they are, no matter who they are. This is our goal. We're so excited to be a part of our expanded network, a larger family of physicians and nurses and healthcare providers. So this is something that I am very proud of as a part of the expanded network. Thank you, President Ramsey. I'm very excited